Living with dementia and a stroke or coronary heart disease can present challenges around pain, medicine, physical activity, and depression and anxiety. There are some things that you can look out for and do to better support the person as well as their family.
Dementia doesn't usually cause pain. However, people with some rare types of dementia may feel more pain. Angina can cause pain that people with dementia may have trouble telling you about. After a stroke, people may feel shoulder pain or pain from stiffness or tightness. In both dementia and stroke, someone may not be able to tell you when they feel pain.
If you think that someone with dementia is in pain, but is having difficulty telling you about it, look out for some non-verbal signs of pain and speak to the carer if they're present.
Because my mother has difficulties communicating now because of the dementia, I have to try and work out what exactly is going on and if she is in pain, if she is having an angina attack. So I say to her, "Are you in pain?" And then sometimes she'll look at me and not being able to respond, and I'll say to her, "Tell me where it hurts." And she'll put her hand to her chest, and then I know that it is an angina attack.
We found that as time has gone on, Mum's become worse at identifying and telling us about her pain. So we often have to look for the small signals such as facial grimaces or her mood changes, tiredness, and it takes sometimes a little bit of detective work to find out the pain is.
The signs that I notice that when Mum's in pain is the agitation, the irritability, the confusion, her inability to express herself, and not being able to settle.
Dementia can make it hard for people to manage their medicines even if they've been doing it for years. Having multiple conditions can mean being on a mix of medicines.
Mum was doing really well with her medicines at first, but then we found that she was getting a bit confused and we ended up having to move to a Dorset pack. She did well with that for quite a while, but then needed to move across into using a Webster pack, which is prepared by the pharmacist. And we involved Royal District Nursing Service in coming in to dispense her medicines in the morning from her Webster pack.
Most people with heart disease and or stroke take medicine to lower blood pressure. If blood pressure falls too low, a person can feel dizzy or lightheaded. This is not normal and can increase their chances of falling over. Some people with heart disease or stroke may also take blood thinning medicines, which can cause them to bleed or bruise more easily.
If you think someone with dementia is not taking their medicine, or you see they're unsteady on their feet, speak to the carer if you can, and also tell your supervisor. If someone is taking blood thinning medicine, take extra care when helping with things like shaving.
Keeping active is important for everybody and it doesn't have to be hard. Walking is good exercise for people with dementia, heart disease and stroke, but having dementia can mean they may get lost. So make sure the person you're supporting is safe to leave home on their own. Some types of physical activity they might enjoy are walking around the house, gardening and dancing. Just make sure they're wearing appropriate clothing and footwear for these activities.
After I had my stroke, I went back to hydrotherapy and Tai Chi because I felt that was good for me. I'm used to being an active person, so I like doing that.
Keep in mind that a person affected by coronary heart disease can experience angina if they walk too fast or too far, or if they exercise too hard. So if this happens, get them to rest regularly during any exercise. You might also need to prompt them to use their angina medicine. A person affected by stroke may not be able to walk without a walking aid, such as a frame or stick. And weakness in their arms and legs can affect their ability to exercise on their own. Make sure the person you're supporting has supervision or a walking aid if it's indicated.
Mum walks with a walker, and we normally do that after breakfast. and I put some music on, some old Italian music, and she'll just circle the house, like walk around the house. She may do it. She may do a few laps, and then when she gets tired, she'll sit down and have a rest.
Some people with dementia can lose confidence and self-esteem as they start having to rely more on others, and this can lead to depression. When dementia, depression and anxiety happen together, it can affect someone's interest in exercise and make social isolation worse. This can increase their chance of a heart attack or stroke. Some people with dementia may become worried and anxious because they notice negative feelings and situations around them. This may also contribute to depression. Depression and anxiety are common after a stroke or heart attack, but its presence may be masked by the dementia and therefore not be picked up. Depression and anxiety are different to dementia, and they can and need to be treated. If they're not treated, it can take longer to recover from a stroke or heart attack. The ways in which you communicate and present yourself can also impact on someone's mood. So keep the following things in mind. Be patient and speak in short sentences with a calm voice. Face the person at eye level. Speak in a calm, gentle, matter-of-fact way. And respect people's rights and wishes. People with dementia can still speak for themselves.
As a carer, we have our bad days too, and our moods reflect, and the people who we care for also pick up on our moods. So if you come a little bit aggressive or agitated, the person that you're caring for, the person with dementia, will pick up on that and probably respond back in the same way. So again, what I have learnt through my experience is that to walk away or find something else to do, or just leave the task for another day or another half hour, and then hopefully come back when you are feeling a little bit better.
To help reduce Mum's anxiety, we used a diary where we wrote out her activities and plans for the day. We also used signs around the house so that she could find things. And we also provided a laminated card with phone numbers of family members so that she could contact them during the day via phone if she felt the need.
And in all of these situations, whether it's to do with pain, medicines, physical activity, or depression and anxiety, remember to write any changes you observe in the case notes and always tell your supervisor.